Such a simple task to move from the science to the policy. It actually is a very, very complicated issue. And just to frame for a moment the science that we've just heard, it sounds like by virtue of us living in this basin, we're at increased risk for lots of adverse health outcomes. And in fact, the statistic that sticks in my mind is that our regional air pollution contributes to about 4,000 deaths a year in Los Angeles County. And that is out of a total of 60,000 deaths. So we're talking about 1 in 15 deaths here that would not occur if we didn't have such awful regional air quality. What we've heard this morning is that in addition to that excess risk, there's this then additional incremental risk if one lives or spends lots of time near a freeway. And I would add, it sounds like being inside a structure doesn't seem to protect you all that much, and being inside a car probably doesn't seem to protect you all that much. So if you're spending lots of time commuting on the freeway or heavy roadways, you're probably at increased risk. We've seen this morning that both the mass and number of particles has greatly increased near the freeways. What I learned actually, which is very, I think, important, is that the ultrafines, which are very bad actors, can cause some nasty things, are at particularly high concentrations near the freeways, but that goes down relatively quickly. But there's tremendous variation based on the mix of traffic and also meteorologic conditions. Season, even, you mentioned, is important. So given that variation, how do you craft a policy that's reasonable? And so I'm going to talk about a little bit about what we've seen. Let me just say, the LA County Department of Public Health is very concerned about this issue. We've spent a fair amount of time within our department discussing what a reasonable policy would be. We've looked at what others are thinking on this, and I would say there's still sort of evolving thinking on it. There's going to be an important meeting next month that's being convened by the California Department of Public Health to bring some public health folks together and also some housing advocates together to sort of talk through the science and what the possible policy strategies might be. So as we looked at what's out there, we saw that the California Air Resources Board in 2005 put forth a policy in their air quality and land use handbook, and that policy is, or at least it's an advisory, a recommendation, was to avoid siting new sensitive land uses within 500 feet of a freeway, urban roads with 100,000 or more vehicles per day, or rural roads with 50,000 or more vehicles per day. They define sensitive land uses as residences, schools, child care centers, playgrounds, and medical facilities. And as I mentioned, it's essentially voluntary. And they did provide a qualifier. They said land use agencies have to balance other considerations, including housing and transportation needs, economic development priorities, and other quality of life issues. In Los Angeles County, the LA Unified School District adopted a policy in 2008 which is consistent with the CARB guidance. And that recommendation, this now is a hard policy. New schools should not be sited within 500 feet of a freeway unless the board finds that either the risk can be adequately mitigated or all feasible mitigation has been implemented, no alternative sites are available, and the benefits of the project outweigh the risk. In our own department, we have a draft document, and I want to underscore it's draft. I know it's out there circulating, but it hasn't been fully vetted within our department or formally approved by the leadership, but it reflects our best thinking to date. And in this guidance, we've recommended a buffer of at least 500 feet should be maintained between the development of new schools, housing, and other sensitive land uses and freeways, and that exceptions should only occur if decision-making bodies find that the benefits outweigh the public health risks. We've added something, though, that the others didn't have. New schools, housing, or other sensitive land uses within 1,500 feet of a freeway should adhere to current best practices related to mitigation measures. There's nothing magical about 500 feet. And so we wouldn't want to mislead anyone to think that, you know, by being 600 feet away, they're absolutely protected. And in fact, there may be some circumstances where there may be not quite as much risk within 500 feet, which is tremendous variation. We also felt that we needed to make a statement about parks. We're getting lots of questions about that. And based on our reading of the literature, we felt this was a reasonable recommendation. New parks with outdoor recreational facilities designed for moderate to vigorous physical activity should be sited at least 500 feet from a freeway, with the same caveats that were noted above. Exceptions only if decision-making bodies find that benefits outweigh the public health risks. And new parks within 1,500 feet should adhere to the best practice mitigation. Things like, for example, if there is a important need to put a park relatively near a freeway, there are many very park-poor areas in the county, at least try to design it in the way that the active recreation portions of the park are furthest away from the freeway. The challenges we've had in thinking about this policy is that there are some potential unintended health consequences, and I'll just give two examples. If we institute widespread siting restrictions, we may discourage compact mixed-use development, which is a strategy that public health is increasingly embracing to increase physical activity and reduce auto dependence. So we have this sort of conundrum here. If you think about land use development over the past generation, or urban and suburban sprawl, that has resulted in many people actually living further away from heavy traffic, but it has also resulted in more traffic. People have to commute everywhere to get anything done. And that has had lots of adverse health impacts. We see it in the obesity trends. And so our department is working very actively to try to create more bikeable, walkable communities, which generally happen if you have more compact mixed-use development. But that then in turn, given our heavy traffic, increases exposures that are potentially harmful. And so we're trying to figure out the best way to balance that. Another example, siting restrictions may reduce affordable housing, leading to increased homelessness and financial strain with the attendant adverse health consequences. There have been studies showing that without affordable housing, with unstable housing, there are adverse health effects. People don't have as much income to spend on health care. They live in a state of chronic stress that elevates stress hormones and can cause chronic disease. So I think it's important not to think about the issue we're talking about today in a vacuum. And some of the challenges, and actually were very much highlighted, I think, in today's earlier presentations. We're talking about multiple pollutants with different risk profiles, widely variable freeway conditions. Dr. Freund's talked about the very different numbers they measured near the I-710 versus the 110 freeway. And so trying to establish a one-size-fits-all policy may do a bit of an injustice to the complexity of the problem. We need to better characterize near roadway risks. Our policy is specific to freeways, but we know the research to date suggests that heavily trafficked roadways also present a risk, and we need to understand that better. We need to better understand how near roadway and freeway risks contribute to the overall disease burden associated with air pollution and other health risks. So if we were somehow able to solve this near roadway freeway problem, how many of these 4,000 deaths would be prevented, and all the morbidity that goes along with the illnesses, how would that be prevented? How much of it would be prevented? And let me just close with a few thoughts about broader policy action and the important need for this. When you think about it, dealing with this problem by establishing policies around siting is sort of it's important for protecting the public, but it's temporizing. It's not dealing with the underlying source of the problem. We really need stronger mandates for use of zero emission and low emission vehicles, including trucks used for goods movement. We need to, some have said we need to establish regulatory standards for near roadway emissions, and there may be some challenges, it sounds like, methodologically to doing that. We certainly need to increase mass transit options as a means of reducing traffic. In addition, it's associated with increased physical activity use of mass transit, which has health benefits. And then we need to promote land use practices that reduce auto dependence. And I'll close there. Thank you.
Thanks, Paul.